Okay, we're live with Liezl. Liezl, can you just introduce yourself and tell us a little bit about yourself and your role at the PHN?
Sure. My name is Liezl. I work at Northwestern PHN. I'm a program officer in the Children and Families team, and prior to that I worked in the mental health team.
Sure, and why have you come along today to this Croakey Go?
Well, I think so my role at PHN when I started was it was a mental health trial that we did in partnership with the University of Melbourne. And it was called LinkMe, and we worked with general practices in our region. And part of that trial was placing a mental health care navigator in the practice to support patients with complex mental health needs. And what we were always aware of was that patients were being referred to various services. And I think it's been quite nice to come today just to get an understanding of what that service landscape looks like, but also understanding that it's not just about supporting the person's mental health needs, but looking at all their needs in terms of their health and well-being, and also looking at diverse populations. So that's why I've come along today.
Sure, that's great. And can you just tell us a little bit more about how that LinkMe trial works in practice? What's the role of the care navigator?
Sure. So what happens is that the care navigator works with the patient for up to 8 sessions, and in that time they develop the patient's mental health treatment plan, which is then approved by the GP. And what the care navigator does is then we've got some funding, and what the funding did was actually allow people to access services that they needed to help them regarding their mental health concerns. And that covered stuff around from your mental health, well-being, physical well-being, recreational activities, anything that you really needed to support you around your mental health journey. So it was a really fantastic trial to be part of. It was really good to see that how that engagement supported people just to be connected to the system in a manner that was tailored to suit their needs as well. And I also think that real engagement between the patient, the care navigator and the doctor also achieved some really good outcomes.
Amazing. And what's next for the program or the trial?
So the trial's actually, so it was only the intervention part of the trial was for about a year. So what's happening now is that the University of Melbourne is conducting 6, 12 and 18-month follow-up surveys with people who participated, and the whole idea is to see that in being part of LinkMe, what were the outcomes achieved for people around their mental health. So we'll be able to see, I guess, from our organization's perspective, what were the benefits for people who were part of it, and how that care navigation supported them in terms of addressing their needs.
Amazing. Thanks so much for joining us, Liezl.
Thanks, Brendan.